What we're talking about tonight, welcome to Mindful Live number 41. It is Friday, the 18th of February. Nice to have you here. Welcome over on YouTube to Sea Sky Nature. Nice to have you there also. The live over on YouTube is there. You can take it in. There's some benefit to the live over on YouTube because when I read the actual news articles, the news articles kind of just scroll behind me while I'm on YouTube. So, yeah. You could take it in there also. And you can go over there. So the stories of the night. Welcome to Mindful Live number 41. The stories that we're covering tonight. Well, we're starting talking about the entire public sector safe zone business that doesn't seem to be able to come off the ground. Good night, Jerry Yearwood. It doesn't seem to be able to come off the ground. It has been delayed yet again. There was a delay from January 17th to February 17th, and now there's a delay pending further knowledge, I guess. The delay is open-ended. We don't know exactly how long this particular delay is going to take, but yes. Yes, I do have yes, Ebonique, I do have a dad. Yes, I have a mom and I have a dad. Yes, Dr. Aishmi Toom, was basically. Yeah. I taught for quite a long time. I taught lessons for a very long time. Since I was pretty young, I started teaching. So it's something that I enjoy, I think. All right. We're starting talking about this vaccine mandate, this safe zone policy that just doesn't seem to be able to come off the ground. Vaccine mandate delayed again. Government's proposed vaccination policy for the public service won't come on stream by mid-February, as previously announced by Prime Minister Dr. Keith Rowley. Attorney General Faris Al-Rawi disclosed that the implementation of the mandate, initially expected to come into effect on January 17th, has again been delayed. He made the revelation while responding to questions from reporters at a virtual media conference today. Al-Rawi explained that the law has been drafted but can't receive cabinet approval just yet, as the Prime Minister is in Qatar for at least a week to attend the Gas Exporting Countries Forum. He said, however, the stakeholder recommendations have been taken into account and have factored into the drafts of the proposed legislation. Al-Rawi added that there are several other considerations that will determine which version of the legislation government will bring to the parliament. The Attorney General said the law has been drafted, but the law must be considered in the state and condition of our science, so that is to come before the cabinet, and the Prime Minister will speak to that issue when appropriate. All right. So, according to the Attorney General, I looked up from the story here to read the TikTok chat, and yeah, y'all do catch me off guard sometimes. Yeah. According to the Attorney General, the policy must be delayed again because the Prime Minister went to Qatar. The Prime Minister went to Qatar. No, Didi, I do not. The Prime Minister went to Qatar, so this policy couldn't have been signed. J. Chris is saying in the chat that he heard people talk about and speculate that the power outage was a low-key protest against the mandate. I spoke about that last night in the live where we went through a story where the OWTU big guy in charge over TNTech said he finds it insulting. And it's preposterous to try to just guess that and come to this kind of conclusion. And I kind of agree. That doesn't quite add up. It doesn't make sense. I don't think people would do something that drastic to protest a policy that isn't even online yet. The policy didn't even seem like it was going to come online. I asked the question, when last, except for when he extended the deadline, when last did you hear the Prime Minister even mention anything about this policy, about this whole safe zone plan? I haven't heard him since the moment he extended the deadline and said, okay, we're having another month deadline. I don't think I have heard anything about that plan. The recommended safe zone policy for the public sector. That recommendation, the plan they have, or they had, or the plan that is yet to be executed, is that they're going to make the public service or the public sector into safe zones. So what that would cause is it would basically be a vaccine requirement, a vaccine mandate for all public servants. But the policy is yet to come to fruition. And according to the Attorney General, it is being delayed again. Now, if you listen to what he's saying, he spoke about the Prime Minister being out of the country, but I find that excuse ridiculous because, I mean, we all knew, a month ago, we knew that the new deadline is going to be February the 17th. So to say the Prime Minister is out of the country so he cannot sign off on this doesn't quite make sense to me. The Prime Minister was the one, who announced that this deadline, the new deadline, is going to be February the 17th. So I don't think he forgot that the new deadline was going to be February the 17th. In order for him to have taken this invitation to go over to Qatar and have nothing to say before that point, I think he very well knew that he had no intention of implementing this policy yet. And when you read what the Attorney General says here, he kind of implies some things that are yet unfinished in the implementation of this law. He says that it has been drafted, but the team of experts need to sit together with the proposals in law because the law has to be applied to the circumstances that we are in, the circumstances that we expect to come at us. A variant today may not be a variant tomorrow. So basically what he's saying there, here's the thing. Basically, let me finish this thought first. Basically what he is saying there is that the experts have yet to sit down with the lawmakers to really go over this thing. So according to the changing science and what has been established pretty clear by now is that the science is in flux. The science changes when it comes to this whole COVID-19 business. And he is saying that the scientists have yet to sit down with the policymakers, with the lawmakers in this case, and really draft this out. Now, Mr. Overcome with the 3 numbers I will not read after your name. Here's the thing. I have moderators in the chat for a reason. To all of you in the chat, I welcome lively discourse. I welcome a lot of disagreement too. Even if you disagree with me, say just that. But we don't do trolling. And the moderators are there to make sure that the trolling doesn't occur. So if you're trolling and if you're being just rude and disrespectful and obscene, you will be muted. That's just by the way. All right. Al-Rawi said the drafts cover liability, the private and public sectors, and how the policy will be operationalized. So that's what the draft has so far. According to the Attorney General, the draft has liability, as in who is going to pay if something happens to somebody. That would be great because that was one of the main points that the unions wanted to get hammered out. He said the draft also has the public and the private sectors included. So the private sector may be excited at that idea because the private sector has been asking for some kind of legislation to govern how they do this entire thing. The private sector has, for those in the private sector that have gone out and made a decision, actually made a decision, they're kind of out on a limb because there isn't really any legal ground for them to stand on quite yet. And that's what many of the chambers have been asking for. They're asking that the government make something really concrete, some kind of legal something, so that when they make their policy, it can be secure. Wahinim again is saying we need a U here in Guyana because I don't understand. What you don't understand, Mr. Wahinim again? Good night, Lulu Rayan. Are you family? Yes, Jalen Titi, I am. And As for me over there in Guyana, I like some Guyanese news in it. I like to take in the Guyanese news, Mr. Wahinim, again. I find Guyanese news is really interesting, so I could cover some Guyanese news for you. I have no problem with that. All right. Now, the space for the science, this is Mr. Al-Rawi speaking here. Listen to this last sentence. Now, the space for the science to be factored and the direction for the cabinet, as the Prime Minister will speak to, has to happen. So the science, according... Yeah, it's drones in Guyana. The science, according to the Attorney General, has yet to be factored in to this new bit of legislation that they want to implement. And I think that may be the main thing that they need to get over. That may be their main hurdle. Because that's kind of what many people were saying from the jump. When you're going to make carte blanche decisions like this, so serious, so stringent, you're going to force people to do something at risk of their job. I think that the science in doing something like that would have to be without a doubt. It needs to be 100% in one particular direction. And it doesn't seem to be that way. It never did seem to be that way. When Dr. Rowley made that statement back in, when that was, the 18th, somewhere around there in December, it didn't seem that way. It seemed like, okay, the numbers were getting to a scary level, and he wanted to make sure it seemed like he pulled the trigger. So, you know, if things are getting scary, you want it to seem like there's a button that you could push, that when things get too bad, you push this button and it's going to do something. But the reality is sometimes those buttons that you push do nothing. And I think this was one such case. And I think it never had a possibility of this thing really having that kind of positive effect. That's to me. And even in the first place, for this policy to come into place, there was, at the same time when this policy was announced, there was a recommendation for a committee to go out into our healthcare service, into the various points. Yes, I've been on some news networks. To go out into our healthcare service to investigate it and see exactly what problems they can see inside of there. They asked for some extension in time because they said the 1 week that they were initially given was just too short for them to do what they had to do. They got that extension. They got a 3-week extension, and then they gave their report. Their report has now been released. Now, I heard Minister Stuart Young, was it? I believe it was him who brought the report into the parliament. I heard him say that this report is on the parliament website. Now, I don't know, maybe I'm just kind of blind. I looked at the parliament website. I didn't see the report. I'll check again some other time, but I did not see the report. So I'm not sure where it is. He said it's on the parliament website, that it is laid in parliament for public viewing. As soon as I heard that, well, I said, great, I'm going to try to at least give this a little skim, maybe read in depth into certain pieces, because I am very curious to know exactly what is going on in our healthcare service. That's something that I would like to know. And this is, I think as Trinidadians, we need to get the correct perspective of these things too. The reality is that these people are providing a service to us. We are paying these people to do us a service, to provide us with a service. So these people that I paid provided a service where they did a report. And I would like to read this report, so I cannot find it. I am only seeing what the minister said. I cannot find the entirety of the report. Maybe, yes, I am on YouTube. Maybe at some later point in time, it would actually... maybe at some later point in time, it would actually be on the parliament website there, and we'll be able to see it. But as of right now, if it is there, I do not know where it is. 8 major findings of the COVID-19 Management Committee. A report from the committee appointed to investigate COVID-19 management in TNT, inclusive of fatalities and patient care, has made a number of disturbing revelations. The 5-member committee, chaired by Professor Terence Simangal, completed its report after being a month after being convened. The findings weren't all negative, as the committee found that COVID-19 management in TNT was carried out according to guidelines set by the WHO, the World Health Organization, and an adequate supply of personal protective equipment was provided. I don't think they are wrong in that sense. I don't think they are wrong. I don't think there's something there like some kind of obvious malfeasance that I am going to look through this report to find. I don't think that I would find such a thing in that report. But I think that it may have some curious bits of information that can be overlooked by some people who may not be looking for that bit of information. Or there may be some information that, if compared to some other bits of information previously released, would provide a nice, interesting view into something otherwise unknown before. So yeah, it's not like I'm looking for them saying, well, okay, the doctors were killing patients. No, I don't expect to find something like that. No, but it would be interesting. Quick question. No, we don't have a curfew. Mr. Guyanese representative in the House, we don't have a curfew. So, sir, we are free to be all around at all times. Well, probably not all around, but generally speaking. However, the committee said the time was far too brief to allow a thorough assessment of COVID-19 clinical outcomes. I think that's fair. If you're looking, number one, WHO cannot approve any vaccine. That is what PNM keeps saying all the time. Sir, I find you're really hard on that PNM and that PNM tree. Nearly anytime someone blames too many of the faults on an opposing political party, you're generally going down a bad road. You're generally going down a bad road. But you're free to do just that. You're free to do anything you'd like to do. But yes, according to the WHO, I think that the committee would be right. I think our general procedure, when you look at it from the general looks of it, it seems in line with basically, yes, I do live in Trinidad, Didi. It seems basically in line with what the WHO has recommended basically everywhere in the world. So I didn't expect to find some differing there. However, the committee said the time was far too brief. Here are some of the committee's key findings. Staff shortages were common from the levels of executive management to doctors and nurses to orderlies and patient escorts. Some doctors had to do non-medical jobs like lifting and moving patients, pulling up patients in bed, and processing nasal swabs. Nurses in some instances also had to carry out duties outside of their regular function. Now, the problem with this first finding was our Minister of Health, when confronted with a story. I don't if you all were watching the live since it began, I believe I spoke about this even in a live, but I spoke about it in a contemplation also. There was a story not too long ago speaking about how many nurses in Trinidad and Tobago are flying out, are leaving. And they spoke about that, especially in juxtaposition to the public sector vaccine mandate. Yes, the nurses, the vaccine mandate that was being pushed. And the Minister of Health came out and tried to counter that, saying that we had so many new nurses coming in and we have enough and we don't have that to worry about. And the news story was wrong. But even then, in that story, I remember going through some really rudimentary math. As I usually say, I am not the math springer, but I went through some maths in that story, and it kind of showed that all the numbers that the minister was putting out there wasn't quite adding up to the conclusion that he was trying to draw with it. But now we're seeing that the committee that went in and actually did the investigation found that the staff shortages that were being alleged were true. So, Mr. Minister, you were wrong. Next, number 2, doctors and nurses complained of overwork almost to the point of exhaustion, concluding that the workload was severe. The committee said it must take a toll mentally, physically, and psychologically. Of course, it must. That's expected. And that also, I think, has something to do with not enough medical personnel. You'd get burnt out if you cannot get someone to relieve you of your duties and you get some time off. If you have enough personnel, you'd be able to rotate staff enough. You'd be able to rotate staff enough and you'd have much less burnout. Privacy and security were also areas of concern raised by the committee. At some sites, 3 to 4 young doctors, male and female, had to sleep on mattresses on the floor in the same room. Some doctors complained that the door to their room could not be locked. The committee said this was particularly worrisome given the current state of crime in the country. Number 4, nurses complained of having to work long hours in PPE, often without a break to drink water or go to the washroom. They also reported that they had to lift and turn patients because of shortages of attendants and orderlies. The committee's report noted that obese patients in particular were very difficult to move. I mean, obviously. Yeah, overcome. You're spelling sheeps with an S, sir. Just in case you didn't notice, you're spelling sheeps with an S. Yeah, and one thing I noted, at least with these issues that were highlighted, something that I noticed is that almost all of these issues seem to come from a medical personnel point of view, which isn't bad, but it makes me wonder if the majority of this investigation was basically questions to the medical personnel and having them answer and drawing conclusions from that, because at least these things being said here seem like they're mostly just what the medical personnel say. What he name again? I think you're right. Good night, Mario. Good night, Rooney. Good night. Number 5, there were frequent complaints about very short locum contracts of 1 month to 3 month durations. The committee said these short contracts create great uncertainty and depress the morale of young doctors who are exposing themselves to great risk. So again, another one of the problems stated from the view of the medical personnel, they found that they were under short contracts, so they didn't have that stable job security. Number 6, there are no guidelines about nursing ratios in a pandemic. However, the committee was told that in many instances, there was 1 ICU nurse nursing 6 ICU ventilated patients. Reports were also received about 1 registered nurse on the ward nursing 20 to 30 patients. Now, all first six of these seem to be problems being addressed from the point of view of medical personnel. And the vast majority of this seems to be, if you were to generalize the general problem in the whole first 6 problems they outlined here, the general problem is not enough staff. Understaffing. We don't have enough medical personnel. Well, I thought that was obvious a little while back, but our Minister of Health reassured us that was fine. But now we're hearing again that it is true. And it is true. There is that shortage. Now, moving on to number 7, the 7th problem that they identified. Tocilizumab, or tocilizumab, whichever way you pronounce it, tocilizumab, an immunosuppressive drug approved in the treatment of COVID-19, was conspicuous by its shortage. Experienced ICU consultants said that they only had about 20% of the required amount of tocilizumab. Pharmacists also agreed that the drug was in short supply. The committee noted that executive management tried to solve this problem by sharing their supplies among the regional health authorities. There were also reports about shortages of of midazolam, methylprednisolone, and propofol. Dexamethasone was used in instances where methylprednisolone was indicated. So they had a shortage in drugs. Now, this is another one of those problems that I would have some serious questions to ask at the Minister of Finance's feet or his conference. Because the Minister of Finance previously said that there was no drug shortage. Again, about a month ago, some personnel from inside the healthcare system came out and said that there was a shortage. Over on YouTube, the modus operandi of the government is to squeeze as much work out of their technical staff for as little compensation as possible. This is prevalent through the public sector, not only the Ministry of Health. One person doing the job of 3 to 4 persons. That's Javid over on YouTube. And that's true. But the real horrible part in this, as you're saying that, when I critique and criticize, which I do quite often, the public service and some of the public servants, and it's a regular trope in Trinidad, you criticize the public service because they generally don't do work up to the standard that many people would like. But regularly, as soon as you start that criticism, a public servant is quick to jump out to say, well, I am one of the hardest workers out there. I am working every day, whole day. I am not wasting time when I am on the job. And here's the thing, they may be right, but that's the entire problem. In our public service, very regularly, you may find some people where one person works for 5, and then you'd have 5 who work for none. So, yeah, but in the healthcare system, it seems apparent like they aren't the 5 who work for none issue because they are actually understaffed. You know, in the public sector, when the union always says, every time you hear anything about the public sector, it's always that they are understaffed and overworked. That's the rallying cry of the public sector since I know myself. But it seems like, honestly, the healthcare facilities, the healthcare staff can legitimately say that they are understaffed and overworked. And there is a drug shortage. Unlike what the minister said, the Minister of Health came out and actually contradicted that when people previously came out and were saying that, yes, we are lacking drugs inside of the healthcare system, the minister came out and rubbished those claims, saying that it is not true. However, this committee says, yeah, it is. Number 8. The high rates of NCDs, which are non-communicable diseases, among the patients who died or who were hospitalized for COVID-19 were notable. The committee deduced that more attention needs to be paid from a young age to the prevention and management of NCDs to ensure that people become and remain healthy. The recommended preventative management be aimed at children, adolescents, and young adults. Further, it said a national survey of NCDs is urgently required and the data used to guide the review and revision of health promotion and treatment programs. I fully agree with that last one. That last one where they spoke about NCDs. That's what I've been saying from the jump. It seems pretty clear to me that the real long-term way out of this pandemic is not vaccination, actually. The real long-term way out of this pandemic is making sure that people are resilient, for the most part, because the vast majority of people who died were people with non-communicable diseases, people with comorbidities. So if we have a population, good night, Flo Christopher, if we have a population with much less communicable diseases, much less comorbidities, then you'd have lower deaths. So for example, for the majority of Africa, the continent, and for those in the live, for those viewing, yes, anytime you hear about Africa, anytime you speak about Africa, you need to understand the context of Africa. Africa is not a country. Africa is a continent made up of many different countries. And even in those countries, some of those countries are more like tribes, and these people feel more attachment and loyalty to smaller tribes, etc., etc., whatever. But anyway, Africa, that massive continent, the birthplace of humanity, the cradle of civilization. they have a vaccination rate, I believe, of under 10%. And their death rate, I believe, may be the lowest of all continents barring Antarctica. Their death rate may be the lowest. So there is a question to be asked there. There's a question to be asked there. And some people point to different reasons. There are many different reasons. The one I really don't like is people say that the Africans, there are scientists that stay on Antarctica for lengthy periods of time. But some people use the argument that the Africans aren't counting their deaths, and that's the real thing. The Africans are kind of, short counting the deaths. Listen, if people were dropping down in Africa, you would have known. There are many non-profit organizations that are in Africa just there to count the people that are dying. If it's one thing you generally get information on out of Africa, is who is dropping down and dying. During Ebola outbreak, you knew every last person that died, basically. So I don't buy that the death rate could have been hidden. Okay, maybe the infection rate could have been hidden because maybe they couldn't do PCR tests for every single person who died. But if there was a ballooning of the number of deaths inside of Africa, we would have known. So I don't buy that excuse. It seems obvious to me that Africa has a pretty low death rate. Some people point that to the fact that a large population of the people living in Africa, if you were not healthy in the first place, well, you wouldn't have survived. And many of those who are comorbid don't generally survive very long inside of some of the difficult scenarios some of those African countries find themselves in. So they may have, generally speaking, a more healthy population, especially when it comes to something such as obesity. The obesity rate in Africa, I wouldn't doubt, would be a fraction of the rate in the United States or in Trinidad and Tobago. So, and obesity is probably the main comorbidity that affects you in getting negative outcomes inside of this COVID-19 infection. Obesity is the main thing. One of the reasons is, I believe earlier on, they realized that the virus actually attaches on to some fat cells, and it actually, so if you have more fat cells, you get a higher viral load in and of itself. So yeah, obesity out there was doing the worst. And I think it's reasonable, that's why I agree with that last statement. I think it's reasonable to say that in the long term, looking on at this pandemic, looking on at the outcomes that come out next year, next 2 years, next 3 years, next 10 years when something else comes, next 10 years when the next pandemic, as Bill Gates tells us, and he knows about these things, in the next 10 years, when the next pandemic, according to Bill Gates, hits us, if you have a more fit population that isn't as susceptible, isn't as comorbid, don't have as many NCDs, well, the chances and the outcomes very likely would be more favorable. Super Mario says it is simple. The death rates in African countries has not increased outside of nominal margins. Exactly. So, yeah, you would have noticed if there was that serious increase out there. And the safe zone policies, because this is all coming from the safe zone policy that the government has planned. This is all coming from that. And we're seeing the recommendations from the committee. But we're seeing also one of the institutions in Trinidad and Tobago that pioneered this safe zone policy, that pioneered this vaccine mandate. One of the pioneering businesses that did that, Republic Bank, has rescinded that mandate, has rescinded that policy. They say they have pulled back that policy because they have reached 92% vaccination rates. Maybe. I guess we would never know, because what happens now is they're petitioning the union because the union has them in court. Good night, Richard Glubman. The union has them in court right now. The union had them in the industrial court over the same policy, and they're petitioning the union to drop the matter in the court because they're pulling back from the policy anyway. And I think Republic Bank showed success in the vaccine mandate policy. They showed what success looks like in many of these vaccine mandate policies. Because to them, that was success. They were able to shake up their workers enough to get their workers to get vaccinated. The ones that were apprehensive went out and still got vaccinated. The ones that were adamant they were not going to do it, well, we whittled down to find out who those ones exactly are. And okay, well, you could stay on the work. Blessings, Damian Sandy. Okay, well, you could stay on the work nonetheless. Okay, fine. We change our mind. You could stay on the work. And the union is right now trying to get them to rescind, because I spoke about this before. Republic Bank, to show you how well Republic Bank did it. Republic Bank had the measure. Like, I phrased this. I saw this. Like, how you would threaten a child. How you yeah, they are still pushing the vaccine drive, but a vaccine drive is much different from a vaccine mandate. The vaccine drive is okay. They're encouraging people to get vaccinated, and there's no problem with that. By all means, go get vaccinated if you should, but forcing them is a whole different thing. Republic Bank had a whole countdown from 5. You know, like if you want a child to listen and you want to play some of those mind games with them, you're not trying to grab anybody's child. You give them that countdown, and you don't really have anything planned for the end of this countdown. But listen to me. You better do this before I count down from 5. 5, 4, 3, 2, 1. What? And you don't really have anything. You're not going to do anything after that. But very often it works on children, and apparently it's still. I'm not calling the Republic Bank staff children, no. But the technique still worked there, because what Republic Bank did was I believe they had verbal, then they had a warning letter, then a second warning letter, then they bring you in, and then they suspend you for a small period of time, and then finally they actually fire you. The thing is, they fired no one. They gave people the warning letters. They gave out those warning letters, but when it actually came to firing, they fired no one. Because here's the thing, that case was still in the industrial court. They couldn't actually fire anyone. But if the workers did not know this, well, your ignorance worked for your disadvantage, and they were scared into making this decision. Yes, I saw they started a vaccine drive at school, but they're saying it's based on getting permission from the parents nonetheless, so that's up to the parents. Our resident Guyanese is saying that just come to Guyana, they have vaccine books selling wholesale. Wow. But yes, the Republic Bank workers fell for it. Now, here's the thing. I say, if you didn't have a proper reason, if you didn't have a solid reason why you weren't taking the vaccine in the first place, well, maybe it's not a bad thing that they convinced you to take it. They probably just got you to get over some of the fears that you had. And if it works for the best, well, grand, wonderful. So that's that. But at the end of the day, that is pretty manipulative. And the thing is, at the end of it, the scare is to scare you at the potential, while they know that the reality is they can't even follow through with this scare. The scare doesn't even follow through. It's just to get you to do it in this moment. But I think from a Republic Bank point of view, if you're a Republic Bank looking out at this, and they said just as much, Republic Bank would be looking at this as a success. They succeeded in their vaccine mandate. Now, on the other hand, I would say from the government's point of view, it's not a success. They did not succeed because the government, the public sector workers, the vaccination rate didn't jump up to 92% like in Republic Bank. No, I believe the vaccination rate in the security services might still very well be under 50%, and they aren't encouraging any new people to go out and get vaccinated. So the policy failed. It didn't work for the scare tactic that it may have been meant for in the first place, and now you may reach a point where you actually have to execute it, and it seems to me like a policy like this is not really executable. Here's where I see some success. The contrary way of going down, instead of going down the route that the government took. If you did like the THA over in Tobago, that is held by the PDP, they said they weren't going along with the vaccine mandate requirement business. They weren't going along with that safe zone business. They said they are for vaccination, but they are for free choice. They're willing to leave the decision up to the individual. Now, here's the thing. The results, as it would turn out, from the point in time when the Prime Minister made that announcement that he's going to mandate this vaccine basically in December, till now, the results between the THA, which is governing Tobago, and the results with the Trinidad and Tobago government and the entire public service, I would say that you can't say that the Trinidad and Tobago government had better vaccination results than THA. And yet still, though, the THA can still now say that we are the more caring and accommodative ruling government, because we didn't try and beat you over the head to get this to happen. We tried to leave this up to you, and the conclusion still ended up as the same thing. If the Prime Minister said nothing about safe zones back in December, and the time elapsed till now as it just did, we would still be in the same position very likely. Very likely, very few things would have been different. So the only thing that that safe zone announcement did was stir up strife inside of the population and make for more difficulty in engagement in between the population. That was the only thing it succeeded in doing. And now to implement that safe zone, I think, would be a very difficult thing to do, even according to the science. If you look over at our neighbors Barbados, safe zones not suitable for Omicron. Good night, Chiny Dogla. Chief Medical Officer, the Most Honorable Dr. Kenneth George, has poured cold water over the feasibility of government moving ahead with plans to implement safe zones. Responding to a question from the media during a virtual COVID-19 update yesterday, George said while the concept was a good one to stem threats from the Delta and Alpha variant, the high transmissibility of the Omicron variant has rendered the measure moot. M-O-O-T. Moot. The concept of safe zones was an excellent concept and was supported by the Ministry of Health and Wellness. However, the concept of safe zones is difficult to do in an environment where you expect a lot of the population to be exposed. So the reality is that as we knew and understood more about Omicron, we discovered the safe zone concept would have applied as a better fit with respect to the Delta outbreak, George said. If I usually speak this fast, well, sometimes. Not all the times, but sometimes. So, according to the Barbadian Chief Medical Officer, safe zones aren't a viable option for Omicron. So, if you have our neighbors over in Barbados saying that the entire concept of a safe zone doesn't work for Omicron, much less trying to do it based on vaccination, how are you then going to come and try and effectively argue that the proper procedure over in Trinidad would be a safe zone now for the entirety of the public sector? I see that as a very difficult argument to make now. I see it maybe as even an impossible argument to make now. The science seems to have moved on from that whole safe zone business. It doesn't work anymore. According to the science, according to the Barbadian Chief Medical Officer himself, safe zones aren't the proper procedure and the proper idea for Omicron. Now, that to me throws cold water also on the entire safe zone carnival idea, that because we are in the Omicron spread, you could be in your boxing ring separate there, someone in their boxing ring separate there, and with the high transmissibility, there may still be a high chance of transmissibility of this Omicron variant. So even the safe zone concept that we have for having those events even the even the safe zone policies that we have for having some of those events seem like they won't work. As I was reading one of the promoters speaking about the technique they use to have their fetes, to have their events, and you could see people dancing and singing with each other because when they come together, they stay in the team. So they have, as it were, the groups. They have a group of 10, and that group of 10 stays and mingles together. So you'd see people probably dancing together in the party, but it's not random people. It's people in their own groups. They aren't spreading in between groups, and they're groups anyway. But with Omicron being as transmissible as it is, if you have all these separate groups but they're in one building, well, yeah, that isn't really a safe zone. That is a spread zone, really and truly. And I think spread is exactly what we'd be seeing quite a bit of. Spread is exactly what we'd be seeing quite a bit of. All right. Now, the next story I'm going to is the next story that seems to be making a bit of the news. Some news on the bail on murder accused, murder charged people, and their access to bail. What's not a bad idea, Empress Rooney? What are you speaking about there that's not a bad idea? I better not hear a peep about rising cases after this taste of nonsense. Well, to me, if Omicron functions as it should, well, not as it should, but as it's expected, the medical director over at Medical Associates, I believe it is, the only private medical center that is treating COVID patients, he said it's time to return to normal because he considered Omicron to be functioning basically like a vaccine. That's what he said. And he wasn't the only one. I said this about 2 weeks ago, hearing it from African doctors. I don't know if any of you that are here, I'm sure some of you that are here were in that live where I checked out some of the information that some African doctors were giving. And they were saying that same thing, that Omicron is the vaccine that they wish they made. That's something that a doctor literally said. And down here in Trinidad, we're seeing some of that same thing. So maybe the spread during the taste of nonsense, as Nisi put it, would not be all bad. Maybe there may be a beneficial side to the country for this. Possibly. Who knows? But we're going on now to talk about this bail business. There was a change in an amendment in a bill to make sure that murderers, if you are charged with murder, you cannot access bail. We do not want you on the streets. If you are a murderer, good night, Rhea. If you are a murderer, you must not be allowed back out. So you must not get bail. Well, that was the general idea. But that was thrown down by our appeal court. So murderers accused can access bail. Now, I think there are some shifts, some shades of changes in understanding that some people aren't quite getting in this whole story that would allow it to make a lot more sense if you do get it. But let's get into the details of this. Appeal court clears way for legal avenue. Bail for murder. Anyone accused of murder will now have an opportunity to apply for bail. This will not be automatic, but will now require the courts to hear an application to determine the merits of each individual case before deciding if the bail should be granted or denied. This is the effect of the appeals court ruling on Thursday as it allowed the landmark appeal of a former murder accused who asked for a declaration that anyone charged with the capital offense should have the opportunity to apply for bail. Chief Justice Ivor Archie and Justices of Appeal Myra D. Namora and Malcolm Holdip declared that Section 5.1 of the Bail Act 1994 was not justifiable in a society that had a proper respect for the rights and freedoms of the individual. What that section of the Bail Act basically says is that anyone can access bail except for a certain group. And they give a list of a certain group that cannot access bail. The general idea of the certain group that cannot access bail is basically any crime that has the punishment for it being death. That's the general idea. Nearly any crime that has the punishment for it being death doesn't have the ability to access bail for that crime. But what the justices said is that doesn't line up with a free society that cares about the rights and freedoms of the individual. And I think they're right. I think they're right. The Attorney General has asked for a stay of this ruling. He has asked for a stay of this ruling because what their worry is that all of the murderers, accused murderers, all of those accused murderers that are currently on remand would now all come to ask and request bail. That's their fear. And they don't want this to happen, so they're trying to carry it up to the the Privy Council, our highest court, to get that. The challenge to the Bail Act was mounted by Achille Charles after Justice Joan Charles dismissed Achille Charles's constitutional claim. Refusing to declare Section 5 of the Bail Act, which makes murder an unbailable offense, Justice Charles said the former murder accused failed to establish that the legislation directly interfered with judicial proceedings or yada yada yada. She had been asked to strike down that specific portion and she didn't. That's why they reached to the appeal court. In her decision, Charles said she could not depart from the previous decision of the Privy Council on separation of powers, nor did she agree that the effect of the legislation removed all judicial input on the issue of granting or refusing bail for murder. She pointed out that judges of the High Court in the past did not grant bail for murder either at common law or by statute. So here's where some of this argument is. They're saying that murder accused people should not be granted bail. While what the justices of appeal basically said is that the idea is someone should be able to ask for bail and that power should be left to the court. So a judge could determine if this person deserves bail. And the previous justice that struck it down, one of the reasons that she struck it down and upheld this, that murder accused people should not be able to access bail, is because she said that generally by practice, justices, did not grant bail for murder. But here's the thing. If by practices, justices did not grant bail for murder, then why did you need it in law? Why did you need it in law if the justices were just as capable of granting or not granting it, and they didn't generally grant it in any case? There doesn't seem to be a sensible case there for not granting it. Achille Charles spent 9 years on remand before the murder charge against him was dismissed in May 2019 by Chief Magistrate Maria Busby Earl Carroll, who upheld a no-case submission, agreeing with attorneys there was insufficient evidence for the matter to proceed to trial. So get this, and you could understand then why he would have a personal grouse with this no bail for murder accused. He spent 9 years in jail, in remand. Now, some people seem not to understand this. When you are charged, when you are arrested and charged, you are not yet convicted. In our system, you are considered innocent until proven guilty. If I am arrested on the charge of murder, and now I cannot access bail because according to Trinidad and Tobago's laws, murder accused people, murder charged people cannot access bail. So now I must stay in remand in jail until my case is resolved. And in Trinidad and Tobago, we know that could easily take a decade. So I will spend a decade in jail while my assumption by the law is that I am innocent. My assumption by the law is I am innocent until I am proven guilty. So under the eyes of the law, I am innocent, yet I am sitting in jail for 10 years. You could understand that perspective when they speak about that whole bail issue. His lawyer was former Attorney General Mr. Anand Ramlogan, and he mentioned something about this also. Ramlogan, senior counsel, presumed innocent meaningless when pretrial delays last years. The presumption of innocence means nothing to a person accused of a crime in the face of pretrial delays which can last over a decade. That was the position of former Attorney General Anand Ramlogan, senior counsel, who successfully argued former murder-accused Akili Child's appeal in which he challenged the constitutionality of Section 51 of the Bail Act. In a statement after the Court of Appeal's decision, which deemed the section unconstitutional, Ramlogan maintained no one is considered a risk to society. No one who is considered a risk to society should ever get bail. This is what he is saying. But equally, people who pose no threat should be allowed to exercise their constitutional right to apply for bail. To condemn a man to prison for 10 years whilst he awaits his day in court to prove his innocence without the possibility of bail is oppressive, cruel, and wrong. It is an injustice, and I agree. Here's the thing. I hate the idea of bail on its own. I don't like the idea of bail. Bail to me is opposite to justice. Bail doesn't run in the same direction as justice to me, because bail would have a scale upon which the wealthier would have better access to better treatment inside of the justice system. And if money gives you a better, if money allows you to have better treatment, then that really isn't justice. That's not fair. So I don't like the idea of bail on its own, but I understand it nonetheless. I don't like the idea of it, but I'm not sure what would be a better replacement for it. That's the thing. If the case was that if I'm charged today, I may spend tonight being processed in some facility, and by tomorrow my case starts, and it's from there till it's finished by next week, and we know what's going to happen. Then no bail for anyone. When the case finished, we know what we're going to do with you, and that's fine. But if the case is lasting years and I'm an innocent man, how are you going to condemn me to prison, basically, for years without proving that I should be jailed? That is insane. That's the kind of thing to really turn people into criminals. If I am put into a facility like that and I am innocent and there's nothing I could do, I just must sit here and stare at these walls for 10 years knowing my innocence. That is I can't imagine the frustration of that. The frustration of that is kind of not even within my imagination. Leave no bail for murderers. Here's the thing. Write what you said there. Is the same thing that the commissioner of police said. He spoke about bail for murderers. But here's the thing. You don't know that these men are murderers yet. If you go and call someone who is on remand a murderer, they may have just cause to sue you for defamation, because they have not been proven as murderers quite yet. So, okay, leave no bail for murderers. There has never been bail for murderers. A murderer is someone who has been convicted of murder, someone who it has been proven that they are murderers. So you can't just say that someone is a murderer and then expect that they must be locked into jail for 10 years until it's proven. But that's the entire thing. How are you going to condemn someone to prison time without convicting them? That is not justice. That is not justice. Now, the problem lies there in the length of time it takes to resolve these cases. I do not want murderers out on the streets. I wouldn't like that. I would prefer murderers are locked up too. I would prefer murderers never see the light of day also. But that's the system. How else do you solve that? And the principle of a lot of these concepts in our system is that it protects the innocent. Blackstone's formulation. It's better that 100 guilty men go free than one innocent man suffers. And if that's the ideal you have, if you lean to that direction, then you would lean to the direction where you must have bail. It's unconscionable to me to have someone sitting and languishing in jail unconvicted of a crime for 10 years. How are we supposed to get progress as a society like that? How are we supposed to have upliftment of our youth if we are seeing this happening? I speak to some of these kind of youth, and that's a hopeless kind of situation. You're at 18 liming with the bad company, as they put it. You didn't necessarily do any specific crime. You just get caught up in one of the general arrests where they arrest a whole large number of people. It just so happened that what you're arrested for ties you up in the system. You don't get access to bail, and now you're in jail for something where they haven't convicted you. That's nah. And they go in there and come out worse. Yes, they usually do. And so many people, to me, we have to come to a conclusion. What do we want out of our criminal justice system? Do we want a punitive system, or do we want a system that reforms, a reformation type system? Punitive means punishment. I want to punish you. I want to feel that, what's the German word? Schadenfreude. I want to feel that kind of pleasure from seeing someone who I think is a bad person get bad things done to them. That's what I want. That's what you call a punitive system. And okay, if you want to punish people, okay, I understand that sentiment. I'm human too. I want to punish quite a few people. I'd love if it could happen too. Yes, I could feel that feeling. But here's the thing. What do we get out of that in the long run? What positive results is produced from punishing these people? If, and this might sound even more cruel, if the case was that we could punish them and lock them out in Antarctica for the rest of their life, and we never have to see them again, then that's fine. But if you're going to punish this person, treat them subhuman, disrespect them, allow them to feel less worthy of human treatment, and then you know what you're going to do? After doing them that for 20 years, we're going to let them back out into regular society, and then expect these people that were treated subhuman for 2 decades to come back into regular society and behave like regular people. Somebody in the process must be idiots. We must be the idiots to expect this to work, right? We cannot be thinking logically and expect something like this to work. Causery 1-on-1 says judges need to have consequences for continuously moving cases. Also, they shouldn't be allowed to move a case more than twice after that. They should have to mandatory hear any case. The thing is, nearly no one wants to get in and touch judges. No one wants to get in to do that. If any politician tries to move in and make it seem like they're trying to make some kind of laws over on judges, that you're going to have accusations that you're trying to remove the independence of the judiciary. So it's a hard thing to tamper with in the first place. Positive radiation, we don't have restorative justice, we have criminal universities. That is true. I remember, yes, I know that. I know judges don't pay PAYE. And the concept is that if we lavish them with all the best things we can give, that it would reduce their incentive to take bribes. I don't buy that reasoning. I'm just saying, I don't buy that reasoning. But anyway, that's my point. How are you going to lock people up for 10 years when they were possibly innocent and expect that they're going to come out any better? That's not going to happen. I remember a show I watched. I can't remember what was the name. I believe it was Johnny Depp, and he was acting as one of the pioneers of cocaine transshipment in the early, 80s, somewhere around there, 70s, 60s. And he spoke, there was a line he said in the show where he entered with a diploma in marijuana trafficking or something like that. He entered a prison and he left with a PhD in cocaine trafficking from prison. That's what he learned inside there. The issue is not the bail, it's the time. Both the prison and legal system needs to change. Richard Glubman, I think this is one of the problems I have sometimes with some of the arguments we have. Blow was the name of the movie. Correct, Schizo. Good movie. The problem with some of the arguments I have, it seems like sometimes when we look at these things, you don't grab the multivariate argument too well. So the issue is not bail, it's the time. But bail becomes the issue because of the time. So if you're saying that the issue is not bail, it's the time, so let's ignore the bail. Let's ignore all bail arguments and all bail conversations. Let's only look at the time. But in the meantime, while we're looking at the time, you have people languishing in jail because they cannot access bail. And you're saying, well, we're fixing the time, we're working on it, but I'm still in jail. So in the meantime, let's work on the bail too. I know the time for the case to call. I understand that. That is correct. That's part of the problem. But while that part of the problem exists, it creates the problem of bail also. So yeah, it would be great if you're charged with murder, and until we find out if you're actually the murderer, you aren't let back out into society. But if the time between us charging you with murder and finding out if you're actually the murderer is 10 years, then that is ridiculous. That leaves it open for even malicious prosecution. That leaves it open for a police officer to say, okay, I could get you tied up in the system and in headache for 10 years knowing you're innocent. Nah. Javid says, anytime inside as a free person is too much time. And I agree. Okay, that's all I have for now for you folks over on YouTube and Instagram. Thank you for joining. I hope you were educated, informed, or entertained. And do join me again Monday night for the next Mindful Live, where I will see you at around 9:30. Anytime between 9 and 9:30 is generally where I sign in. And I will see you then. I'll be on TikTok for a little while longer, just hanging out for a bit. If you want, you could join me over there. Until then,